Hi, Michael. Good morning. How are you?
Hey, good. How are you doing?
I'm good. I'm good. So how's Nashville?
Nashville has been wonderful. It's been just a phenomenal conference. I love it that we're just seeing so many digital disruptors, which is much needed in this industry.
Amazing. So, I would like to know a little bit more about you, about your journey.
Yeah, absolutely. So thank you again for having me. My name is Michael Archuleta. I'm the Chief Information Officer with Mount San Rafael. So we're based out of Trinidad, Colorado. And I mean, the journey has been phenomenal. We've seen how just even the overall evolution of the CIO has really come into fruition. We've gone from being an advisor to really driving the organization, which is so critical. And what I love too is that we're seeing true digital transformation. That has been really my passion. My passion has always been, how do we re-leverage what information system means to an organization? Because you figure technology is really the backbone, one of the foundations that really creates an overall company, correct? I mean, and that's why I always state that in the end, hospitals and clinics are digital companies that deliver healthcare services. We're living in the digital age of healthcare. And that's really the bottom line because the overall focus here has been how do we go away from that brick and mortar theology of what healthcare has always been and really just focus more on becoming a digital company and then looking at seeing how the CIO and how technology and technology investments have always been considered what a cost center. That's an issue.
Yeah.
And with my overall focus and advocacy and just really trying to focus and change the culture, I've been able to really look and re-leverage what technology means. That we can no longer could be a cost center, but a strategic revenue contributor to the organization. And that is so critical
Yep.
because even at one of my speeches, so I basically spoke Monday here at Vive, and I basically stated that ladies and gentlemen, we have to tell the Flintstones to come meet the Jetsons. It's about time.
Yep.
It's really about time for change, and we need change more than ever. And we've seen this industry being disrupted, and we've seen so many amazing things really happen. But you figure too that we are behind the curve when it comes to technology advancements. We are many years behind the curve when it comes to technology advancements. Look at the oil and gas, look at the finance industry. But the thing is we're doing the most important thing out there, and that's saving lives. That's
Yeah.
dealing with patient care. We should be leading the pack when it comes to digital transformation and innovation. That's so critical. And that's why I always say, too, is that my new CEO, I don't care what you do in healthcare, everyone has a new CEO. They're like, okay, well, who is my new CEO? Your new CEO is the patient. And
Amazing.
that's basically the bottom line.
That's a really wonderful thought. The new CEOs are your patient. Amazing. So would like to know more about what Rafael Hospital is doing, and as a provider, what are the key things that you look out, to provide a better service, and what are those aspects?
Yeah, absolutely. One of our critical components that we've done as an organization is we really had to redefine what digitalization means to our group. We also had to really redefine some of the digital strategies that we built, around the business, around the roles, around the partnerships, and around the technology that we basically incorporate. One of our critical components is that as an organization, we realize that if we do not continue to invest in tech and if we do not continue to build strong asynchronous tools that benefit our patients both inside and outside the organization, we're not going to be successful moving forward. And the culture understands the importance of what we have to do, and that's so critical. It's like one of the most critical components out there is continuing to enhance patient care with the utilization of technology. And that's really a critical component moving forward because if we can enhance patient care, we're doing what we're basically
Yep.
established to do.
Yeah.
And the critical thing is how do we just advance this? How do we give more of a consumer experience to our end users? Because this is one of the most antiquated industries out there.
Yeah.
You know that. And that's such a sad thing. But like consumer experience is so critical too. And that's why I stated Your new CEO is a patient. You don't continue to build specific tools for these patients. These individuals are going to look elsewhere.
Yeah.
They are taking more control of their overall patient care. They have more data than they've ever had. So they can make those specific choices on, well, I want to go to this other specific organization versus your organization. So the thing is we have to be innovative. We have to think outside the box on how we basically promote specific initiatives that really enhance our overall process. And you figure automation point is such an important thing too.
Yeah.
How do we basically create more efficiencies? Because we are doing more with less. And that is such a hard thing at times. And it's so sad when you look at the evolution of the electronic medical record system. These poor physicians, in the end, we have to let doctors be doctors. How do we basically create some more enhanced initiatives utilizing some tools that would benefit our physicians, create more automations, create more efficiencies, stop the burnout of what's happening to these
Yeah.
poor doctors. This is what we need to do, is use technology as a tool. Don't don't look at technology as that cost centered. Look at
Yeah.
technology as a true strategic revenue contributor to the organization. And this is the problem too, is that when we look at the evolution of IS, information systems, we've seen that they've always acted as what? A
Yeah.
ticket taker, right? It's like they are always receiving tickets, tickets, tickets. But we have to refocus that around going from a ticket taker to a true value maker. And that is really critical, because if you could bring true value, true efficiencies, true productivities, true automations to your organization, you're basically leading the way moving forward from there.
Great. Some really great insights there, Mike. So, in this new world, right, where tech is playing a really important role in revolutionizing things, especially on the healthcare side as well, how is the role of CIO changing, right? And how critical is it? And what are the key aspects a CIO has to, kind of keep in mind while making sure the organization grows in a good way?
Absolutely. So, I mean, that's a great question. And just as you stated, the revolution, I mean, honestly, that this, ladies and gentlemen, this isn't a technology makeover. This is a true business revolution that we're basically needing complete change and the incorporation of true digital transformation within the organization. And you figure we've seen the evolution of how the CIO has gone from crawling to holding the organization up, from that advisor to that driver. And that's really critical too, because you figure your technology leader is such a critical component to your overall success moving forward. And as I stated, if an organization does not incorporate technology as a core component to their overall organizational strategy, they're not going to be successful moving forward. And that's why I said too, Ashi, is that we have to get away from this brick and mortar theology of what healthcare has been. I mean, that is a major disservice. It's like, ladies and gentlemen, we're in the digital age. We need to be leading the pack when it comes to innovation. Look at what's happening with our industry as a whole, even on a cybersecurity
Yeah.
standpoint. Because they're not really focusing on the importance of the CISO, the importance of security, the importance of technology. I mean, these have to all really refocus. We went from the top 10 to the top 6 most attacked industries out there. That is a major issue too. And you figure, I always state on a security standpoint that cybersecurity isn't just about data security. It's also a matter of life and death.
Yep.
I mean, for example, look at the pacemaker software alone. There was 5,000 security flaws associated with that. Look at the medical device industry that's mandated by the FDA. 83% of those specific companies have admitted that they have a cybersecurity problem.
Yeah.
This is an issue, and this is why it's so important to realign and have a true CIO that is transforming the organization. Because honestly, you have to be a transformational CIO. Because if you're not a transformational CIO, you can't really realign the focus of the culture within your organization. I mean, it is going to be very, very hard to continue to basically evolve, because you figure healthcare isn't getting easier. It's getting harder. It's getting more complex. We have a lot of regulatory and compliance items. We have a lot of security issues. We're a very antiquated industry. There's a lot of specific issues here that we see that we need to basically push forward. We need to evolve moving forward. Let's get rid of the brick and mortar theology. Ladies and gentlemen, it is about time. Tell the Flintstones to come meet the Jetsons because honestly, that is the honest truth.
Great. Some, I'm getting inspired by just listening to you. Just some really amazing thoughts here. So, in this new world, as you're saying that things are getting more complicated, building a critical team, right, is important. Building a team is like very critical, right? So as a CIO, what are those key factors that you're looking at building a solid technology team? Because it to your point, it can no more be just a cost center, right? So what are the thoughts on that?
And that's the thing too, Rich. That's an excellent question. That's why I always stated that IS needs to move away from that overall focus from being a ticket taker to a true value maker.
Yeah.
Your team is one of the core components to your overall department. And that is really an important thing for me is that teamwork is so critical.
Right.
Building, and that's why even part of our overall digital transformation strategy, we focus on partnership. We focus on specific roles. We need to determine that we have the proper talent in place to basically make some items happen. And that's really a critical component to anything that we do. And see, the beauty about this too is I've been a very young CIO in this industry, and I've been, recognized by so many different organizations, which has been such a humbling experience. But the thing is, though, is you figure I had to really develop a no nonsense framework initiative. And everyone's like, okay. And I said, this is the thing. If individuals know me, that there is two different categories that I look at. I look at your talkers, which are basically the ones that talk this big game. They talk about innovation, but it's like it never happens. And they don't live in our shoes. And then there's the GSDers. And everyone's like, okay, Mike, I always see you hashtagging GSD. I always see you doing this. And I said, well, ladies and gentlemen, this is one of the critical components is that I've built that no nonsense framework. I've been able to really transform this organization from nothing to something. We went from a very late adopters to the electronic medical record system initiative when the Affordable Care Act came out to a full digital company that delivers healthcare services.
Nice.
We went from a 2015 to a 2021 Most Wired winner, which is a top nationally recognized healthcare IT award given to the top facilities making the most progress of health IT. We're also a HIMSS Analytics Stage 6 facility, which is a feat that only 30% of U.S. hospitals hit. And they're like, well, yeah, you're a doer, Mike, that's for sure. And I said, well, ladies and gentlemen, that's why I'm a GSDer. That's a complete different. They're like, okay, what's a GSDer? I said, well, that's getting shit done. And that's basically the bottom line. We have to GSD. We have to have that no nonsense framework. We have to basically grind to really make some changes because I am not a talker. I'm a doer. We have to basically develop a strong team to become doers. And that's why I stated we have to move away from these specific silos that IS has always built around. We have to basically go away from that mentality and that cultural focus that IS is more of a ticket taker. We're a true value maker. We're a disruptor. We are a digital transformational team that's basically taking this organization to the next level. That is a strong initiative that we basically need to really mold to build stronger teams moving forward.
Amazing. Uh, so I would like to understand, the impact that your organization has created so far, and where do you want to take it? The whole impact game.
Yeah, absolutely. I mean, there's a lot of, again, there's a lot of complexities still. There's a lot of regulatory items. There's a lot of items coming out. The Cures Act, um, different specific items, the Patch Act initiatives. I mean, there's a lot of specific, items coming out that the organization really needs to really re-evolve into. We've seen the value-based care initiative, going from a fee to service to more of a value-based care outcome. I mean, and utilizing technology to create some consumer experience initiatives, which was extremely critical to our overall success. And we're just seeing this overall, just the evolution and transformation. We're seeing how telemedicine has just been a huge disruptor. We're seeing that, this is what I always state too, that during COVID, COVID was one of the worst times this entire world has
Yeah.
seen. It really was. And we lost a lot of amazing individuals, and it was such a sad situation. But a lot of these healthcare organizations, in my opinion, didn't have their home in order. And when I say that is, when we started sending people home, or when we basically had work from home, remote initiatives, we were trying to roll out telemedicine. We as an organization, thankfully enough, we had a strong foundational backbone on the technology initiatives. So we were able to send our people home effectively, efficiently, securely. We were able to basically, spin up our telemedicine, our telehealth clinics very effectively. And this allowed us to be just where we needed to go. And, ladies, the specific board of directors and the additional members are like, okay, wow, the light bulb click. This technology is really important. Look at
Yeah.
what we're doing. We're not suffering as an organization. I've seen a lot of organizations that didn't have their home in order, didn't really focus on that strong technology backbone, which is so critical to the organization. They were struggling with sending people home. They were struggling with spinning up telemedicine, telehealth clinics. So this was definitely an issue, and that's why I continue to say is that we really need to re-evolve on the focus of what hospitals and clinics are. But also, we really need to start looking at incorporating more automation points, more initiatives towards artificial intelligence. I think when we look at AI as a whole, and AI is such a buzzword, but artificial intelligence is really an excellent way to really incorporate an excellent just addition to your organization. I know everyone's, afraid that artificial intelligence is going to be taking over jobs, but the thing is I look at it as more artificial intelligence is going to basically be an additional tool
Yeah.
to help create better efficiencies moving forward. Even on the healthcare standpoint of things, I mean, look at what our AI is doing on the radiology standpoint. It's basically able to look at different specific items that the human eye can't basically catch. So there's benefits, but also there is cons to artificial intelligence as well too. I mean, there has to be more regulatory just compliances towards that.
Yeah.
We're just seeing how even ChatGPT is just evolving so much, but it is a scary thing on how they're basically utilizing it. But there is pros and cons to the use of AI, but we really have to look at incorporating those specific processes in our organizations to continue to build strong efficiencies. And that's why I stated, cultural change is so important. And I think that either these organizations are going to evolve to being a digital company or they're going to be left behind,
Yeah.
unfortunately. And you definitely don't want to be that organization that's left behind.
Yep. Yep. And to your point, it's all about making the best use of the technology that's coming up, like AI. And of course, there's one angle to it about the jobs, but if you are able to take it to the next level and use them to your advantage, I think that collaboration has huge number of advantages.
I fully agree with you on that.
Awesome. So my final question, right? So what's the purpose of your organization? What's the purpose of your hospital, and where do you see it's going?
Absolutely. I always say that my number one thing is patient care. That's basically the bottom line. I'm so passionate about this overall industry is just of really enhancing better patient care outcomes. I mean, better ways of doing research, advanced technologies to really save people's lives. This is where we're advancing to. Digital transformation is such an important thing to our organization. And that's why I basically stated too is that my new CEO is a patient And that's basically the bottom line, because if you think about it as a whole, your patients are the ones that are truly driving revenue to your organization. And they could really take their care elsewhere moving forward if you do not continue to build strong tools that benefit these patients both inside and outside the organization, which is so critical moving forward. So that's why I stated transformation is here, ladies and gentlemen, but we need that disruption moving forward. We need innovation moving forward. We need just a lot of good initiatives that are really going to take us to the next level. Because honestly, we should be leading the pack when it comes to innovation. We should be leading the pack when it comes to digital transformation. We should truly be leading the pack when it comes to really enhancing better patient outcomes. And you figure we need to move away from this overall antiquated industry to that true digital organization that delivers healthcare services. If we could really focus on that, if we could really realign ourselves, we could really learn from all of these opportunities, especially during COVID, that we've seen the importance of incorporating technology as that core component and really focusing on going away and being a true value maker within your organization. And again, this has been a phenomenal conference, seeing so many disruptors, seeing so many innovation initiatives. And I'm so honored to be here and be a speaker at this event to really share my story. And it was kind of funny because, I was looking on LinkedIn, Twitter, and all those social media platforms, and I was being quoted all over from, hey, tell the Flintstones to come meet the Jetsons. Because honestly, ladies and gentlemen, it is time. It is definitely time that we move forward in this process. We have to reevaluate our overall strategy, really start incorporating technology as that core component to the overall organizational strategy, move away from being that ticket taker to a true value maker, being a GSDer. Let's GSD together. And that's such a critical thing. And let's start incorporating innovation, like bringing in startups to the groups. These third party companies coming in and really disrupting. We need this more than ever. We cannot continue to have this monopolized, EHRs in place that don't want to work with specific vendors. We need interoperability. We need to see what FIRE is doing, on the fast healthcare interoperability resource. We're just seeing so many good things, but we need to go faster, and we really need to get to the level where we've always needed to be moving forward. So again, really honored to be on this podcast. I really appreciate the invite, and it's just been a phenomenal time.
Thank you. Thank you for joining us. It has been a very inspiring and thought provoking discussion, I must say. I love hashtag GSDers. So, just waving everybody who are watching this. I hope you learned something new and I hope you liked what you heard.
Well, excellent. Thank you very much.
Thank you.